I don't know what happened. Okay, so we're ready to go.
We are live now.
Okay, thank you. Well, let me welcome everyone who's joined us for this AIB work session. And thank you for your attendance and your participation today. My name is Britt Kerwin. I'm the vice chair of the AIB board. Our chair, Ike Leggett, is on vacation, so I'll be acting in his stead today. I do want to recognize my colleagues on the board who are here today. Dr. Jennifer Lynch, Dr. Laurel Stapleton, Mr. Fagan Harris, and Dr. Myra Doss. Of course, we also have our executive director, Rachel Heiss, and her very able staff. I think we have a few members of our advisory. Umani Diallo, can you turn on your screen or so we can see you, Umani? Ellie Mitchell, Robin Werner, Kirk Murray, and Jaden Ferris. So we want to thank you especially for joining us today and for your willingness to serve on the advisory committees. And
Mr. Chair,
yes.
Sorry, excuse me for interrupting. There's one more advisory committee member who's joined.
Good.
David Harper.
Oh, good. Well, David, welcome. And just want to, again, say how much we value and appreciate your willingness to serve on the one of the advisory boards. And we look forward to our engagement with you in the coming weeks, months, and over the next period of time. I want to remind everyone who's on the call that this is a public meeting. It's being live streamed and recorded. In the past, at some of our earlier meetings, we had a cap of 100 participants, not because we wanted to cap it, but it's because of the software, the platform that we were using. That restriction has been removed, but if anyone on this call couldn't participate in the meeting because of that cap, we do apologize, and that little snafu has now been corrected. In any case, this and all previous and future sessions have been or will be recorded, and we are available on our newly launched AIB website. We're very pleased that the website is now up and running, and it has just a wealth of information on it. And I think we're going to put in the chat the link to the website that should be in the chat now. And we encourage you to go to the website and use it. And I think you'll find a lot of very good information on it. So let me give the context and purpose of today's work session. B is in the process of developing, as it is mandated to do, a strategic implementation plan for the blueprint. All entities involved in the implementation will have to, the local boards, MSDE, the CTE board, et cetera, will have to submit their implementation plans in response to the AIB plan and submit those to the AIB for approval. We plan to have a draft of our plan in October, and then the final plan is scheduled for December. As part of this process, we've scheduled weekly public work sessions in which we do a deep dive on the pillars of the blueprint. In these sessions, we want to hear from the public and from groups, interested individuals and groups, about questions they have about the various pillars. and issues that folks feel we need to address as we put our plan together. Today, we will continue our previous sessions on pillars 3 and 4. Board members Fagan Harris will lead the discussion on pillar 4, and Myra Doss will lead the discussion on pillar 3. Before we get into these discussions about the pillars, I want to ask Rachel to explain the protocols for public participation in today's session. So, Rachel, could you kind of just review that for us?
Sure. Thank you, Mr. Chair. So essentially, we're following the same format that we have for several meetings now. So we would ask that everyone keep your cameras turned off and muted, your sound muted unless you're called on. But please put any questions or comments in the chat box as we go through the meeting. And if we, either the facilitator or myself, feel that it's helpful to ask you to come off camera and speak, we'll do that. We may also call on some of our guests from state agencies or other folks to potentially respond to questions. We really appreciate the participation of everyone in the previous meetings, and really look forward to some more productive conversations as we try to keep getting closer to identifying all the details that we need to flesh out the comprehensive implementation plan. The chair did, vice chair did note that the chat transcripts are on the website, and I'll just give you a little more information there. So if you go to the meetings tab across the top and then to the meetings archives, you will see all of the meetings there. And specifically, you'll see chat transcripts for the meetings where we've been having these public interactions. So that's where you can find that. And under the implementation plans tab, you'll see on the side left-hand menu, pillar 1, 2, 3, 4, 5. If you click there, you will find materials from these meetings, the graphic and other materials posted there. And I think, what's the next slide, Emma? Okay. And so as the chair said, we're talking about pillars 3 and 4 today, and we're actually starting with pillar 4.
Yeah. So Rachel, let me ask you if you could kind of review the issues from our last discussion of pillar 4, and then Fagan will moderate our discussion of.
Sounds good. So at the last working session on pillar 4, we went through the graphic that we have for each pillar. And we actually were able to make our way through all of the objectives. So just as a reminder, pillar 4, and then 4.1 is objective 1 under pillar 4, and so on. And so we did cover at least somewhat all of the objectives. 4.1 involves the proxy for identifying students who need more resources. And using low income eligibility as the identifying factor for identifying students who need more resources. And we talked about incorporating Medicaid data into the direct certification, which is one approach to identifying students who need more resources. We also talked about developing a state alternative form, which is one of the requirements in the blueprint law. And we also talked about MSDE's work that the superintendent is leading on neighborhood indicators of poverty and a poverty index based on those neighborhood indicators, and the final report, which is due in November. 4.2 objective relates to English language learners. And that discussion really centered around the English language work group that the Superintendent Chaudhary is chairing, that is looking at best practices for English language education. And we'll get into that a little bit more in a minute. 4.3 really is based on the funding formula and the increase in the funding formulas for EL students and special education students under the Blueprint Law. 4.4 relates to the concentration of poverty school grants, the new grants in the community school model that is being implemented as part of the concentration of poverty grants. We talked about the personnel grants, some of the challenges to providing full-time health coverage at schools, particularly during the pandemic, especially when schools were closed. And then also the needs assessment that is required for every school that receives a concentration of poverty grant. And then the beginning of the phase-in of the per pupil funding for eligible schools, which is being received by schools starting this current fiscal year 23, the 2022-23 school year. And then the last item relates to student health. And we spent a lot of time talking about the Consortium on Coordinated Community Sports, the new entity that was created to really work with school systems and sort of be the liaison between the school systems and the private providers and the community providers to really address the needs of particularly behavioral health and mental health needs of students, as well as we talked a bit about the enhancement of school-based health centers. So that's sort of a summary of the 5 objectives under Pillar 4. And then I think what we would like to do, and Mr. Harris, if you want to say a few words about sort of how we're going to go about this session, because it's a little different because we actually made it through everything last time, but there's still plenty of things to talk about.
Yeah, thanks, Rachel. I think we just want to invite folks to register comments or additional questions, or if there's pieces here and some of the big takeaways that we need to kick the tires more on today or discuss, this is the time to do it. I see a comment coming in here from Scott Tiffin for 4.5. One thing that came up recently for me was that the consortium does not have a school counselor seat. School counselors are important to supporting the needs of students. To the extent possible, this could be a minor recommended change from the AIB to ensure the consortium has all relevant voices represented. I think that's a great point, Scott, and we'll take it under advisement and work on that.
If we could go to the next slide, we tried to sort of provide some high-level summary of some of the questions and comments that we received during the last working session, and there were several related to 4.5, other than what Mr. Tiffin has just raised. I do know that we have Mark Luckner from who is staffing the consortium on the meeting, and I don't want to put you on the spot, Mark, but I don't know if there's any response you might have to Mr. Tiffin regarding school counselors. I believe that the consortium is not fully appointed yet, but you do have your first meeting coming up next week.
Yes, thanks, Rachel. Thanks for the invitation to join, everyone. It's great to see everyone. Hope everyone's having a nice summer. So thanks for that update. So pleased to report that the legislature has appointed the chair of the consortium, and his name is former Delegate Dave Rudolph. And we've been meeting with Delegate Rudolph. I still call him Delegate Rudolph, or maybe Chair Rudolph now, over the last couple of weeks. And in fact, he came to our office in Annapolis, and we got up in our office, and they redid our offices so the wall is, you can write on the wall. So we had this really detailed brainstorming session with Chair Rudolph, the staff at our commission, and then Sharon Hoover from the National Center of School Mental Health Services that was written into the bill, you'll recall. So yes, Rachel, number one, we have our first orientation meeting for members of the consortium this coming Wednesday, August 17th at 10 a.m. It'll be on the computer like this is. And thanks for letting me join, because you're giving me some good suggestions on how to run that meeting. It'll be open to the public. And Rachel, thanks again for offering to help present. You're going to be a tough act to follow because we're coming after you on the agenda. But regarding Mr. Tiffin's point, there's 24 members on the consortium. And as Rachel said, there's a few final appointments to be made. And one thing that we were talking about with Chair Rudolph and Sharon and others in our office is, after that initial meeting in August 17th, and then additional public meetings in September and October, November, we're thinking about having a process by which in this fall, we engage the public and key stakeholders on aspects of that are going to be required in the first call for proposals and the first year and so of the program. And I'd like to talk with you, Rachel, more fully on that. But I think one hallmark you're going to find in what the consortium does, because this is how the commission implements its programs, is we're going to have a robust, comprehensive, and transparent public comment process. So even though of the 20 plus members of the consortium, there may not be a school counselor, we would absolutely welcome and encourage school counselors. And if there's an association of school counselors or particular individual school counselors that Mr. Tiffin would like to connect us with, we'd be delighted to talk with them. And their contribution is valued and appreciated, even though they may not be a formal appointee of the consortium. So I hope that addressed the question, Rachel. And thank you again for coming to our meeting next week.
Thanks. That was very helpful, Mark. And I'm looking forward to it. And I still call him Delegate Rudolph too. So hopefully, I do think I believe there is an association of school counselors. And so I think we can help to make sure that that information makes its way to you and the consortium. I don't know, do we want to talk about some of the other issues that came up around maybe 4.5 since we've started that conversation? So you can see there are three kind of questions that were raised around enhancing student health services. One, which I'm not sure that Mark has or the consortium has thought about this yet, but I think it's something that would certainly we would want to ask the consortium to think about this too, is how to monitor essentially whether student health issues that are identified are actually treated either by a school-based provider or through a referral. But as we all know, oftentimes referrals don't actually end up in receiving any services. So I think that's a really important point that was raised at the last meeting, and something that we need to make sure in the comprehensive plan that we raise that as something that we want the LEAs and the consortium to address in their plans in terms of how they're going to track and monitor that. But again, if anyone, as I'm sort of talking here, if anyone has a different suggestion or a reaction to what I'm saying or anyone is saying, please feel free to put something in the chat. And sort of related point was made around how student health outcomes will be reported at the state level. That's a very big question around student health outcomes. And I think we would want to definitely engage with the LEAs, the Department of Health, and again, the consortium, particularly around behavioral health, mental health services, so that we can make sure that the data is being tracked and the outcome data is available to the AIB. And I don't know, maybe the longitudinal data system could potentially have a role there too, although health data, I think, is not specifically part of the LDS Center right now. And the last item, and I think it was Mr. Tiffin who raised this, raised questions about how the expansion of school-based health centers would be rolled out, and how the blueprint is involved in that. And essentially, the blueprint law supported full funding for the original anticipated school-based health center initiative. And that funding is coming available in the fiscal 23 budget. The what is not, I think, sorted out yet is how those centers will be distributed around the state and where they will be, where they'll be located, both within LEA, by LEA, and within communities. And so I think Mr. Tiffin had suggested that the AIB might want to engage more in that, whatever plan that the Department of Health and the LEAs and MSDE hopefully are working on around the expansion of school-based health centers. So that's another element that we would want to include in the comprehensive plan, so that those entities would then come back to the AIB with what their plan is for how they want to expand school-based health centers. And then the AIB would be able to sort of weigh in at that point on the plan. I see a few comments in the chat box.
Yeah, so Shamoya asked, is the AIB aware of the status of district level behavioral health coordinators provided by the law? Few, 6 LEAs mention them in their student trauma and behavioral health reports. And there's a concern that the vision and practice are not aligning right now. So I think that's a excellent flag. And I think as this part of the law gets kind of rolled out and scaled up, that's precisely the kind of stuff that I think we've got to pay attention to. And then Scott's also got a comment here. Would also be helpful to understand how the compensation of school-based providers is changing under the blueprint and progress on ratios. There will always be equity issues with referrals. So it'd be helpful to see how, if we are expanding school-based providers. I think also a great question.
So the school-based health center, so the blueprint calls for additional school-based health centers, and there is a, and I am not an expert on those, I will freely admit, but what I do know is there's sort of a template for what is required, what type of staff need to be part of a school-based health center and what kind of services they have to offer. And as part of the grant agreement, now school-based health centers coordination has moved to the Maryland Department of Health. When the recommendation was first made, the blueprint law first passed, it was still within MSDE. But the Maryland Department of Health, within their grant agreements, I believe, set the compensation levels. So that is something that we can certainly dig into further, but it is something that is, oh, behavioral health providers. Okay. That's a different question. So just for everyone, so there's sort of school-based health centers, they do, some of them do provide some behavioral health, mental health services, but they're very much focused on physical health for the most part. So expanding school-based providers on the behavioral health side, again, this is essentially a big piece of the role of the consortium, is trying to sort of manage the expansion of school-based providers versus using community and private providers. Since they're just holding their organizational meeting next week, they probably haven't had a chance to think about some of these issues yet, but it sounds like they're going to be holding similar meetings to what we're holding now, the AIB is holding, that they'll be holding similar meetings in the next few months. So I think these are, and we can certainly flag these to follow up with the consortium on from our end. But I think also I would encourage you all to join in on the consortium meetings and share your thoughts with them as well.
Got a question here from Shane Tate. Shane, can you come on and ask your question here?
My environment's a little noisy, but my question was certain structures like local care teams that come through the Governor's Office of Children really have augmented some of those referrals and engaging some providers. They have the capacity to do that. Is there any plan to make recommendations to school districts to ramp up resources to increase the capacity of those local care teams to be a solution to the shortage in counselors?
It's a great question.
It is a great question. And that's definitely something we will take a look at. There is funding through the blueprint that was provided through the foundation program that and through some of the weights that was tied to meeting the national ratio standards or association standards. And so the funding was embedded in the blueprint formulas to achieve those ratios for psychologists and counselors. There is actually, I think maybe it's on the next slide. We actually thought we had something about monitoring the, thank you, student supports there, back one, two. There you go. Right, so monitoring, so this also came up at the last meeting, and I think it's a really critical indicator that we want to make sure that is being tracked and that the AIB is monitoring the ratio of students to social workers, guidance counselors, and I would add school psychologists there, so that we have a sense at the LEA level and hopefully at the school level what the ratios are and how close we are to the standards. And number two there under student supports sort of dovetails with what I was just talking about around coordinating the expansion of school-based health centers so that they're equitably distributed around the state and both by regions of the state, but really within the communities and within LEAs that have the greatest needs. To me, Denis, I'm probably not pronouncing your name right, but Denis, could you talk more about? It sounds really interesting what you're doing in your county.
Well, it's more like what I tried to do. It's Denny, like slam bam breakfast. Denny's the and what I did was that I gathered all the federally qualified health centers, and they all, believe it or not, agreed on a set price on what they would charge individuals, right? And if you could believe that the fact that they all agreed was just a feat. The thing was that I requested, we have about $5 million that we put in and annually, and that only comes up to half. And with 10 million, with an additional 5, we could basically treat every single person, regardless of status, regardless of insurance capability, throughout the entire county on on preventive health and a series of criteria. Similar to what is done in Baltimore City, similar to what Montgomery Cares program in Montgomery County. And so what we were thinking is that a lot of these federally qualified health centers were like, well, why don't we insert ourselves inside the schools, community-based programs, and divvy up the schools so that each person has a certain number of schools where they could be present at. And in these schools, we can treat both the student, the family, and whoever else comes in through the community. So that was the idea. And we could achieve that with $10 million inside the county. However, there was a political difference between me and my county executive in that she did not care to pursue that direction. But maybe now, hopefully, me being in Annapolis, this could be this could be something I can propose at that level. But I think it's exciting. I think it's innovative. I think it's the direction we should go.
So again, I'm like not an expert on FQHCs, but I know enough to be dangerous. And I think that's a great idea of how to leverage FQHCs in the community. And part of the creation of the consortium was to try to leverage those community, not just FQHCs, but other hospital community providers that do have the ability to provide services to the schools.
Exactly.
So I think that's fabulous. I hope that hopefully Mark Luckner is still on and listening, and maybe you two could talk about this and flesh it out a little more. I don't know, I should say, whether that would require any changes to state law. But I'm guessing it would, because usually it does when it involves FQHCs. So that would be something that perhaps you all could work on.
I'm totally on board. This is something that I've been working on for the last several years. So this didn't come out of the blue. So the fact that we've been meeting for over like a year and a half to 2 years, I think it's been really exciting. Just the fact that, like I said, just the fact that we got everybody to agree. And the things that we were able to agree on, like the prenatal care, the mental health pieces, I think could really, given the dollars that we're investing in the blueprint, I mean, that is totally leveraging one upon the other. And I think that we could totally get a return on investment, as you highlight with just measuring outcomes, measuring improvements, the whole family
Right.
benefit. So I'm all on board. So if anybody wants to work with me on this, I am more than happy.
Thank you so much.
Shamoya also put something in the chat that I think has come up before, but she asked if school-based health centers should be co-located in community schools. And that has been, that was certainly discussed as part of the commission. I will just say the blueprint doesn't specify one way or another in the law. The commission had some robust conversations about that and ultimately decided that it should be a policy decision that was made sort of with more information about the availability of health services in different communities. The expansion of school-based health centers is not as large as the expansion of community schools. So there would never be enough school-based, at least not in the current proposal, to have a school-based health center in every community school. And so instead, that's why the full-time health coverage requirement was part of the community school model in the blueprint law, but that's certainly something to be, further explored in terms of whether at least some school-based health centers should be co-located in community schools.
Yeah, and I think just building off the next question, Rachel, from Evie Frankel around kind of the relationship with Maryland Department of Health and what we're doing to kind of facilitate interagency cooperation. I think those are the kind of opportunities that we will be working with our peers across the state and the kind of various systems that are touching this to think through, how do we leverage community schools to the extent possible? Because obviously those community schools are going to have coordinators and resources to align a bunch of different services for their communities. And so I agree, let's not reinvent the wheel and let's not make everybody figure this out from scratch, but rather offer some guidance and leadership at the top. So I think it's a great suggestion from Shamoya, and it's something that we'll pay attention to. And then we've got a comment here from Sarah. FYI, Caroline has a school-based health center in every Caroline County. Okay, has a school-based health center in every school provided by our regional federal qualified healthcare center. Chop Tank Community Health are also provided school-based dental behavioral health. Chop Tank also has a school-based health center presence in the other mid-shore counties as well. Great, that's good to know. Thank you.
That's really, really helpful information, particularly as a model for trying to sort of build that to scale around the state.
Rachel, I think let's move to 4.3. I would just say on 4.5, just to reiterate some key points, that this fall is going to be a pretty critical time for figuring out what a lot of this is going to look like over the next several years as it unfolds. And I think this feedback is spot on and really helpful in focusing our thinking about where we need to steer those conversations so that we can make the most out of this opportunity. And I think it's important to acknowledge that these are going to be new muscles that we're building. And this is going to be kind of new workflows as we work with the Department of Health to get this implemented and executed. But we're going to do our level best to make the most of it, because I agree with Denny. This is a potential game changer if we can play this right.
Absolutely. Did we cover, so 4.3, I think, is the next area we wanted to touch on some of the questions that came up. And this relates to the increased funding for special education and English learner students. And so one of the questions that was asked was whether the funding weights for special ed and EL apply to pre-K students as well. So I did look into that further, and the special education weight does apply to pre-K students. It is part of the blueprint law. And so for every special education student, 4-year-old or 3-year-old that is enrolled in pre-K, they would, the provider, public or private provider, would receive the per pupil amount under the pre-K formula plus the per pupil amount for a special education student, recognizing that those students have greater needs. For English learner students, they are not included in the enrollment count. And at least based on at the time in the commission's discussions, there was some concern about, as we all know, making sure we're not over testing early. And also it appears that pre-K students are not formally, at least not statewide, evaluated for language proficiency in 3 or 4-year-olds. They're not included in that count, which is what is used to determine the English language funding. So at least for now in the blueprint law, special education weight does apply to pre-K students. The English language weight does not. So just wanted to make that clear to everyone. And then the other question that was asked was really around the transparency on tracking the flow of funding under these three formulas that, at least in the commission lingo, typically those formulas are referred to as at-risk student formulas. The commission used a different terminology, a more hopeful terminology of at-promise students. So we call those the three formulas for low-income students, English language students, and special education students. And I think I talked a little bit about this at the last meeting, but there is a new requirement in the blueprint law
Next call, and I have to.
that requires the funding for those three formulas and other funding in the blueprint. LEAs have to demonstrate that those dollars, at least 75% of them for the low-income students and English language students, and 100% of special education funding has to follow students to the school. That is a new requirement, and that data will be reported by the LEAs to MSDE and then to AIB, and AIB is required to monitor that. And so there will be significant transparency around that. And just this morning, there was a group, another meeting of the work group that is working with MSDE on the building out the new financial and student data system that is going to allow for the the reporting of this information from the LEAs up to the state, so that it is not as onerous of a difficult to do, so that we can collect this information, be able to track it and share it publicly with everyone. So I think that covers this slide. I don't know.
Okay, just a few more comments here, Rachel. So comment from Catherine, there's a significant gap in vision care for students across the state, shown by the Vision for Baltimore and only one Maryland Community Health Center that offers vision care. Also pointing out the collection of student health needs data to support the work of the behavioral health coordinators, which is key to ensure quality of health services.
That's
So,
a really, really good point.
Yep.
On the need for data to support the behavioral health coordinators. Yeah,
In the vision piece. I mean,
of
we've
course. Yeah.
Baltimore City, like, so key. And then from Leslie, any way to make a policy statement that the special education weight should not create presumption towards more restrictive placement. I don't quite know what that means. I'm sorry.
Leslie, do you want to explain what your question is or comment?
Yeah, sorry, I couldn't unmute. Yeah, just when there's that additional funding for kids with special ed, that we want to make sure that doesn't, because kids with disabilities may have more intense needs, that there's not that doesn't create a presumption that because their needs may be more intense, that they need more restrictive or segregated special ed placements, but that in fact that money can be used to provide the supports and the services in their neighborhood schools, in less restrictive settings, particularly when you're talking about very young children, preschool kids, that we want to make sure that they're in the environments they'd be in if they didn't have disabilities, and that weighted formula shouldn't create a presumption that just because they have disabilities, they need to go somewhere else and be only with kids with disabilities. And that's always been a concern about a weighted formula, that it could potentially lead to more segregated special ed placements.
Got it.
No,
Thanks for
it's
sharing
absolutely, yeah, absolutely. I mean, as I'm sure you know, the federal law requires students be placed in least restrictive environment. And the whole intent of adding the extra funding for special education students in the full day pre-K program is to integrate those students into the classrooms with non-disabled students. And so that's exactly the point of this.
Right, and I appreciate that. But we also know from the data that gets submitted to the feds that Maryland segregates kids into separate schools at the fourth highest rate in the country and has pretty much consistently for the last 30 years. So that's why I raised this concern. Because it's been, we know what the law requires, but it has been very, very challenging to really address this, and particularly because where kids end up in preschool will often dictate where they end up in school as they get older. So it's really, this is really critical. And thanks. I don't want to take up more time.
No, you're right. It's very critical. And so we definitely, I'm glad you raised it. It's definitely something we want to make sure. The intent is all there for how this should roll out, but we need to make sure that's how it's actually implemented. So maybe there we go. Thank you, Emma. So, the English language learners work group was discussed at the last session, and there were some questions raised about what type of recommendations the work group would be making. And that kind of led to some comments about how the work group's recommendations would be incorporated into the Blueprint Comprehensive Plan. And so we've got this point here that that the AIB would like to incorporate the work group's recommendations into the Blueprint Comprehensive Plan as much as it is relevant and possible to do so. And so hopefully we can receive recommendations in enough time to be able to do that.
Yeah, and this is a priority for us. So we're gonna work this out and get that recommendation so that we can feed it in.
And then I guess continuing with our special education EL funding discussion here, another question that was asked at the last meeting was whether students who qualify for both special education services and English language services would receive both funding for both of those, and the answer is yes. They absolutely do, under the Blueprint law, receive funding for both special education and EL, the full funding. And then there were some really good comments at the last meeting about the shortage in providers for health services, especially related to special education or IEP, individualized education programs for special education students, and the need to address the shortage of those providers in the health services area in particular. I think that would include like speech pathologists and things like that. The funding that is provided through the special education formula can be used to address compensation issues as well, if that's something that is needed to address shortages. So I just wanted to kind of put that out there. The funding has to be used for special education purposes, but it can be used for compensation as well as just hiring more providers or implementing creative solutions. A lot of good comment in the chat about collecting student health data. So this is something I think we should definitely really wasn't maybe on our radar as much as it should have been. And so I think this is a really good flag and brings up a whole different issue related to collecting data. In the education world, it's FERPA. In the health world, it's HIPAA. So, right. And then sharing the data. Yeah. So we're going to definitely need to tackle that. And rely on those of you who have a lot of expertise in the area on how to do that. I don't know. I know I'm guessing if there is anyone on the meeting today who could talk about the new Maryland Think, that would be helpful. So I'm thinking that is a way to maybe connect up some of this health data. It's a new interactive database that MSD, Department of Health, Department of Human Services, and I think a few other agencies are engaged in building right now. So that's something that we should follow up on. Just making a note to myself.
Hey, Rachel, this is Mark Luckner.
Oh, yeah, Mark.
I have a contact for you there if you'd like.
Fabulous.
Mhm.
Thank you.
Mhm.
Okay, thank you. Thank you, Senator Lee. Talking about a Maryland Cybersecurity Council meeting that is going to be talking about student health data broadly, not just students and privacy. So we'll follow that too. And then the last item on this slide has to do with that the proxy for students who need additional services and supports, which in Maryland and pretty much all states use poverty as that proxy. There's a new alternative state form that is supposed to be created by this Department of Education to collect income eligibility information from families. So this would be a state form separate from the federal form that is used to determine eligibility for free and reduced price meals, which has some complications because it's federal benefits that are being received. So it has some other challenges if families fill out that form. So creating an alternative state form. I don't know if anyone from MSDE is able to either now or afterwards provide us with an update on where that developing the alternative form is in the process and when it could be rolled out.
Hi, Rachel. Mike Hirschenfeld here.
Hi, Mike.
How are you? Yes, so not much of an update, but I did want to just come off and say it's something that is in the relatively earlier stages of discussion that we're going through and working with stakeholders on that process. And so there's that's pretty much the bulk of that update. But obviously we will through that process be continuing to engage with AIB and state and other stakeholders in that development.
Okay, so any idea when it would be, or any timeline for when it would be available? Like obviously not this school year, but potentially next school year, or?
I think that would be the hope. I would be cautious to promise a specific date when that would be ready, but I think you're right in assuming that we would need to be prioritizing the development of this in a way that it could be easily rolled out for that following school year. Yes.
Okay. Okay, thanks. That's
Thank
helpful.
I noticed in the chat that, is it Denny Taveras had a proposal on measuring health, poverty. I wonder if she might, or he might tell us.
She.
Sorry, apologies.
It's okay. Okay, I'm cuter than the butler behind me.
Yeah.
So what we did is that we met during the time of the coronavirus. We were in the first couple of rounds of emergency rental assistance, we were giving it to anyone as they came in, and we weren't really prioritizing based on need and based on the individuals that were most likely to become homeless. And have no other alternative. And so we were looking at an equity model where we looked at housing insecurities by census tract, looking at percentage of COVID exposure, house overcrowding, single-headed households, and a conglomerate of sociodemographic factors. And then we would add it as a overall risk in terms of overall risk, to measure overall risk of that individual being able to survive. And so in that helped us be able to, instead of you being able to give rent assistance to Pookie because that's who you know, you were able to provide and target individuals that lived in 30% AMI, 40% AMI housing. And we were able to really divvy it up a lot more equitable. So similarly, I think that this is something that we can look to provide assistance to the neediest in terms of measuring poverty and using this model as a proxy. I believe that the Transforming Neighborhoods initiatives also looked at the same issues with regards to looking at factors of individuals who had the likeliest percentage of dropout rates and such, and crime rates, and being able to target those very specifically. So those are things that maybe we can look at. I can show you what we came up with, and maybe you can tweak it to your needs.
Thank you, Denny. I'm gonna ask Mike Kirschenfeld to connect with you. I know the superintendent, MSD, is working really hard on this neighborhood poverty index concept, and it seems like what you're suggesting might it fit into that.
Mm-hmm. I think so. I think it would be very useful, and the data is already there. You could do it through BEA, or you could load it up through the census. So it's just an issue of just being able to target the data and pull it up.
Great. We'll make sure you're connected with Mike. Oh, good. Mike, he put his email in the chat there. Thank you. And I see that Evie Frankel made a comment about the form, right? And so right now the blueprint law is sort of takes a very let's try every approach to counting students and see if we can, through these different methodologies, we get the best count we can get. And so there are challenges with the federal form for certain reasons. There are challenges with any form for other reasons, because either families just don't want to share that information, or, as you point out, older students, particularly in high schools, the number of students who bring in the signed form, it really drops off because students, high school students don't, as you put it, are embarrassed to bring them in. And so that's why we're also looking at this new potential use of census data for the neighborhood poverty index, and also why we're also in the law now moving towards incorporating Medicaid data into direct certification counts, which use income eligibility information from other programs within the state that require income eligibility, and connecting them up in a database so that nobody has to bring a form in or do anything, because you just kind of match up the data and count those students. So we're really using a big tent approach right now to figuring out the best way to count students living in poverty. And so potentially one of them will at some point become the best option, and we can let go of some of the other approaches. But there will always, well, I shouldn't say always, but in the short term, at least, we do have the federal requirements for free and reduced price meal eligibility, and that does require filling out the federal form. Or unless the school or school system is participating in the community eligibility program.
Just a few more comments on forms from Catherine. Vision for Baltimore found that moving forms to be given at registration brought the return rate from 45% to roughly 90 to 100%. And then a question from Shamoya: did the direct certification methodology Maryland uses expand its measures to collect Medicaid?
So that's a great comment, Catherine. I think the issue is that students don't necessarily register every year. So you're not going to have that students at that entry point every year, but I hope that that's already happening, but that's a good flag. The direct certification methodology. So what the blueprint law called for MSDE to work with the Department of Health to incorporate Medicaid data into the direct certification count. In order to do this, we had to get a waiver from the federal government, which we have received. And so MSDE is moving forward this year to incorporate the Medicaid data into the data set that determines the direct certification. The Maryland, the CHIPS program for children has an income cutoff level that is very similar. It's not exactly, so for free and reduced price, for reduced price meal, it's 185% of poverty. There's 189% poverty level eligibility in Medicaid in CHIPS that aligns very nicely to the free and reduced price meal requirement. So that data, my understanding, and we can certainly confirm this with MSDE. I don't want to necessarily put Mike on the spot at this moment, that data is going to be incorporated into the direct certification counts for this upcoming fall. So that would be for fiscal 24 funding.
Great. And Rachel, can MSDE just speak briefly to the current process for determining schools' poverty level until kind of all of this gets ramped up?
Well, so I can answer that, and then Mike, if you want to add anything, or anyone from MSDE. So direct certification is being used, and also the federal form is being used, and essentially what the law says is whatever the higher number is the number that's used. There's also a provision in the law that specifically specifies how the count is done for systems that are participating in the community eligibility program. So they have a different way of doing the count, and a hold harmless provision is in place for those districts. And essentially those, Baltimore City being the largest district that participates in that program. So that what that program does is it provides the school system with funding to give everyone in the system a free meal, a free breakfast and lunch. And then the school system is reimbursed based on a certain amount for their meals program. But then for state funding, we have a hold harmless in place so that those systems are not penalized because once everyone is getting a free lunch, they're really unlikely to fill out the form because they really don't need to. And so there's a hold harmless provision for those districts that's in place and through fiscal 26 now, I believe.
Thank you, Rachel.
So I think the last thing we wanted to cover, and we're just about out of time, are the concentration poverty grants. And there were a couple of comments at the last meeting about really important items that we need to make sure are incorporated in the plan to track the use of the personnel grants. And again, what the personnel grants do is they provide funds to every school for a full-time community school coordinator and to provide full-time health coverage during the school day, including any extended school hours. And so one specific comment that came up related to monitoring whether schools are actually meeting the full-time health coverage requirement. And that is something that I don't believe has been happening up to this point. And then also I do know that there were some challenges, particularly during the pandemic, of being able to meet that requirement, in part because in many places, county-based staff also serve as the school health nurses, and they were diverted to supporting coronavirus testing. And so I know there were a lot of challenges, and we're still kind of in the pandemic. We're not out of it yet, at least, but there were certainly challenges in the 2021 and I think even in the 21 to 22 school year. And then I see that Ellie Mitchell has a point in the chat box around the per pupil funding, and whether the schools with the lower concentration of poverty, which starts at 56% concentration of poverty, whether the per pupil funding amount is enough, essentially. So that's something that we can take a look at as the funding formula is implemented further and those schools are actually receiving funding. It's a few years out in the implementation phase in. And I think we're through everything and we're at time.
Yeah, and there's some other great comments here that we'll capture. I saw one more come through from Shamoya. Thought for the near future for students in the care of DJS, DSS, or those experiencing transiency or homelessness. Are we accurately counting them? It's a great comment, great question.
So at this point, I think we will again capture everything that is being put in the chat box. We'll incorporate that into the work for the next meeting, and we'll also download the chat transcript. It will be available for everyone to be able to access on the AIB's new website. And at this point, we do want to remind everybody that there is a forum that you can provide additional feedback. If you think of something after the meeting or you want to clarify any points that you've made, please use the forum, and I'm going to ask if someone from the AIB staff would put that in the chat box, please. And then next Thursday, there will be a summer working session on Pillar 1 that will start at 1 p.m. And we are going to be scheduling at least one more working session on Pillar 4 and each of the pillars this summer. So we've got about, a month and a half left of summer, technically. And so we will be scheduling at least one more for Pillar 4. But at this moment, we don't have a date for that, but we'll keep everyone posted. And you can check back on the AIB website also. And with that, any closing comments, Mr. Harris?
No, I just want to thank everyone for the engagement today and for pushing our thinking. And I think we're going to have a busy fall tackling some of this stuff, particularly around the health piece and the English learner. So we appreciate it.
Well, let me thank you, Fagan, and Rachel for leading us through this discussion. Lots of good suggestions, ideas, questions have come forth, and we will definitely add this to our agenda as we put together the portion of the implementation plan related to Pillar 4. We're going to take a 5-minute break now, and according to watch, it's 2:15, so back at 2:20.
Great. Thank you, everybody.
Thank you. Please just mute and turn off your camera during the break.
Okay, Rachel, are we ready to reconvene?
I think we are. I see Dr. Doss,
Our leader?
most important person we need.
Great. Well, so we're going to turn now to Pillar 3 and continue the discussion on it. So, Rachel, let me ask you to sort of summarize where we are with Pillar 3 in the discussion, and then we'll turn to Mara to help facilitate the conversation.
Sure. Just for the benefit of anyone who may not have been in the first part of the session, we are following the same format and protocols as we have in previous meetings. So please put any questions or comments you have in the chat box. And Dr. Doss or I may, or Dr. Kerwin may call on you to say more about what your question or comment is. And we did want to let everyone know that the AIB website is now up and running, and the chat transcripts from each of the sessions, working sessions, are have been downloaded and are available on the website. It's aib.maryland.gov. And if you go to the meeting archives, under meetings, there's meeting archives, and the chat transcripts are available from each meeting. So while folks who are just watching the meeting cannot see the chats, but we did want to make sure that the chats were available to everyone. And I'll just go ahead and put the website email address in the chat for everyone. And then, so starting with Pillar 3, then at the last meeting, we were actually able to cover most of Pillar 3, but not all of it. And so what we want to do is just briefly summarize what we were able to cover, and then we will pull up the pillar graphic and sort of work our way through what was not covered. So what was covered was, we had a pretty robust discussion about Pillar 3, Objective 1, 3.1, which is opportunities to become college and career ready by the end of 10th grade and no later than the end of 12th grade. And there were a number of questions that came up about that we will come back to after we cover 3.2, which we were not able to discuss at the last meeting. And then 3.3 relates to the college and career readiness pathways. We had some pretty good discussion on that, but we didn't cover everything. So we are going to touch on that in a minute after we talk about 3.2. And then we did spend some time talking about 3.4, which relates to expanding career counseling and also career and technical education offerings. And again, there was some really good discussion about the new requirements and new pathways there. And we'll come back to that in a few minutes. But now I think what we want to do, Dr. Doss, did you have any introductory comments you wanted to make before we dive in?
Sure. Thanks, Rachel. I just wanted to say thank you to everyone, for those of you who have returned and those of you who are new, for joining us in this session. I personally appreciate the opportunity to bring in the public and actually work on some of these and hear your questions and concerns. That it's so very important. And what we didn't say when we were going through what we covered at the last session, because it looks like it's kind of chip choppy, and it's like, why did they do 3.1 and then 3.3 and all that? Well, what we did, we wanted to make sure that we touched on our CTE part of this expansive pillar, not unlike the other pillars, but Pillar 3 is packed. And so we have a CTE part of this pillar, and we wanted to make sure in that session that we did spend we did spend some time there. So that's why it looks kind of choppy and out of order, but it's not, trust us. So thank you, Rachel.
Absolutely. Yes, that's a really, really good point. We were able to have some folks from the CTE committee, the staff from the CTE committee were able to join us at the last meeting. And so we wanted to make sure that we touched on 3.4 while we had them there. Okay, so Emma, if you want to put the graphic up and we can dive into 3.2. So 3.2 is keeping students on track to meet college and career readiness. And that is obviously, sorry, just trying to minimize. Okay. That is a critical point. I just need this to be a little bigger for me, so I'm just putting it on my other screen. Okay, so objective 2 under pillar 3 is keeping students on track to meet college and career readiness by the end of 10th grade. And so 3.2.1, just to remind you, so 3.2.1 is a task under the objective, keep students on track to meet CCR. So 3.2.1 is the first task, and that is to provide intensive intervention services to students who are not on track by the end of 10th grade. And so this is what is sort of referred to as the college and career ready support pathway. So this would be specifically for students who are in need of additional interventions so that they can, actually, sorry, I think I'm misspeaking here. That's 3.3.1, my apologies. So 3.2.1 is interventions for students who along the way are not on track to becoming CCR by the end of 10th grade. So it's not students who have been found not to be college and career ready, but who, as we build out the instructional system so that it's all aligned to our updated college and career readiness standard, we want to make sure that we're really identifying students who, as soon as they start to fall behind or fall off track of the CCR pathway or requirement, that we're identifying them, that teachers are providing the additional interventions and supports that are needed so that they get back on track as soon as possible. And so the first subtask, so 3.2.1a, A is a subtask, is providing tutoring to students in kindergarten through 3rd grade who are struggling in reading and math, if appropriate. And this program is also known as the Transitional Supplemental Instruction Program, or TSI. It is part of the blueprint, and funding has actually been provided for this program since fiscal 20. So it was part of what we call the Bridge to Kerwin legislation. And it essentially provides funding to school districts to provide one-on-one and small group tutoring to students who are either not proficient in reading by 3rd grade, or who are identified as not on track to being proficient by 3rd grade. And that is one of the critical indicators of success, future success in school, is whether students are reading on grade level at 3rd grade. And so that program phases up, and funding is continued to be provided through fiscal 26, I believe. Yes, fiscal 26. So the star to the right there, you can see the yellow line with the back arrow in fiscal 22, which means there was funding provided before fiscal 22. And then the line goes to the star in fiscal 26. And it is fiscal 26 when that funding phases out. And the reason that it phases out is because at the same time, subtask B is phasing in. And this is the additional non-instructional in front of the classroom time that teachers are going to have under the blueprint. And part of that time, which is often referred to as collaborative time, but it's not only collaborative time, it's also time to spend time looking at student data, assessment data, observation data, just observations, and identifying students who need more services and supports, and the teachers themselves starting to provide that support. So we phase out the hiring of separate tutors through the TSI program and bring in the additional teachers who we're going to have in the buildings, and so that all the teachers have more collaborative time. And part of the use of that time is this one-on-one and small group tutoring. So that is 3.2.1, the task of providing these interventions.
Right, Rachel?
Mm-hmm.
Before we leave this, someone asked me the other day on this particular 3.2 that there are very specific things up through the third grade, and then there's we want to be sure up through in the 10th grade we test to see if people are college and career ready. What specifically happens between grade 3 and grade 9? How well does the blueprint speak to keeping programs to keep kids on track?
So the blueprint law specifies that part of the whole purpose of, once we have a updated college and career standard, then what needs to happen and what is required to happen is that the instructional standards are updated from grade 10 back through pre-K, so that the entire instructional system is aligned with this new college and career ready standard,
Right.
Whatever updated standard, whatever updates need to be made. And then once that occurs, there's also language in the law around MSDE working with with lead teachers and others to make sure that high quality instructional materials are available. There's also the state curriculum that will be available to use. They're not required to use it. We talked about this at another meeting. They're not required to use the state curriculum, but it's available to them. And then again, this additional time that teachers will have to identify students who are not on track for college and career readiness. So the intent is that the whole system is designed to identify and provide those supports as soon as possible to students pre-K through 10 and beyond who are off track.
So presumably, if say in the 5th or 6th grade, a student is off track, we have this larger cadre of teachers in the schools, and there would be targeted attention to students who might slip off the track between grade 3 and grade 9. That's basically the idea. Is that correct?
Yeah. And once the TSI funding is rolled into the providing more teachers in the schools, those teachers would be doing the same thing for the pre-K through 3 students.
Okay. Thank you.
And Shanetta said that she had the same question too, Dr. Curran. So great minds think alike, I suppose. with this whole 3.2, actually, it can be characterized in listening to Rachel and the explanations as sort of like timely, targeted intervention when, where, and how needed, and wraparound support. We have, or we're going to have, an updated CCR. And so we're not just going to throw the students in and say, well, if you're not here or there and you're not at the expected level, well, then so what? We're going to make sure that we're actually taking care of the student and making sure that we're actually providing the students what they need, whether it's tutoring, whether it's some other type of support, but we're making sure that we identify when and where they are so that they can get to that CCR standard. And I know I'm saying CCR standard, and I know those questions are going to come. So I'm going to stop talking about CCR standard for a minute and go to the chat and see what questions we actually have. We have a question, Denny. Denny, can you come off camera and ask your question?
I'm trying to remember what it was. Hold on a minute.
You asked about the funding. Is it limited to schools or education?
Yes, yes. So, I have this idea, well, not, yes. I've been talking to certain individuals regarding how to bring in built-in hardware inside the community to build the community from within. So the question is, and using all aspects of the community. So this funding, is it strictly limited to in-school activities or directly associated with, let's say, nonprofit educational based nonprofits like Hillside Scholars or Latino student funds that do work in this space, or are we looking more broadly? Obviously, these people have to have, if not a track record, they have to have clear outcomes that they need to meet in order to have continued funding.
So the funding, the funding that we're talking about, all of this funding is for the public schools, and which includes charter schools, just to be clear. And and then the public school systems do have some flexibility to hire other providers to provide services for some aspects, particularly for the TSI program, the transitional supplemental instruction. There are some specific requirements in the law about hiring certified teachers to provide the instruction. And I'm trying to just quickly refresh my memory here about what they are required. Let's see. Well, actually, they don't have to be certified necessarily, but they may be employed by the school district. They don't have to be hired by the school district, so they can be other private providers depending on what the needs are in the school system. So that is something that is essentially something the school systems get to determine in terms of how they want to deliver services in the schools. And this is specifically dealing with tutoring under the Transitional Supplemental Instruction Program. There are also wraparound services through the Concentration of Poverty Funding and the Community Schools model that can also provide tutoring and can use providers. And I can see some comments in the chat box about out of school time provider organizations.
And Dr. Lynch did have her hand up for a question, but I'll just make sure that I get back to her. I'm not seeing her right now. We have a question from Nancy Shapiro. Can you share where we can find the college and career readiness standards?
So currently, so hopefully MSDE could share that. They are on their website, MSDE's website. The state board has adopted standards that are the state's what are referred to as the college and career readiness standards currently. They have specific standards that go from grade K. I'm not sure if they have pre-K yet, but they will through grade 12. And then particular what we're referring to as an interim CCR standard for meeting this, whether you're college and career ready as an indicator. And the state board every spring adopts what that standard is for the upcoming school year, as we await the completion of the CCR study and recommendations on an updated CCR standard. So I don't know if Mike is available or not. But if not, if someone from MSDE could, I see Mike coming off camera. Could you share the link? Say whatever you would like about this question and share the link on the website. That'd be very helpful.
Yeah, I'm taking a look for it now. I think you covered it in terms of right now, as far as what has been adopted by the State Board of Education, it is that interim standard that's defined in Blueprint, or it's the measurement, because the interim standard defines the standard in terms of scores related to assessments based on existing standard, like the narrative of the standard. And so it's an interesting process to be simultaneously thinking about cut scores versus actually changing text of a written standard. And so yes, I don't want to waste time on this, so I'll go back on mute while I look for this on the website, and I'll plug it into the to the chat box.
Okay, thank you, Mike.
Mara?
And
Mara,
yes.
Yeah, real quickly. I mean, just because of this question, shouldn't maybe we mention that the college and career ready standard is a major. We have an interim standard now, but we're working on the new standard that will become the driver for the blueprint bill. And that's MSDE has hired a consultant to help develop this standard. And when will that be? And that work's supposed to be completed sometime in the next calendar year, Rachel?
Right, by September of 2023 is when that study.
Right. So what we have now is only an interim. That's
Right.
going to be the real standard that will drive, as I say, the blueprint bill.
Right. So maybe it would be helpful. So these questions around the CCR standard are obviously really important to talk about. And just so people might be confused, because we covered 3.1 at the last meeting, we're skipping it and starting with 3.2. But maybe it would be helpful, Emma, if you scrolled up on the graphic and just shared with everyone. So 3.1 is the CCR standard, and the objective that all students have equitable opportunities to become college and career ready, and that they meet the CCR standard at an equal rate. So we want to have an updated CCR standard that reflects in 3.1.1b there, an empirical study that is based on what students need to know and be able to do to succeed in entry level courses at community colleges or post-secondary training in English language arts, math, and when practicable science. So that is what the study that MSDE is in the process of hiring a consultant to do will be working on. And to Dr. Kerwin's point, that report is due by September of 2023. And then the state board will take the results of that and adopt an updated CCR standard. I think timing wise, most likely in the spring of 2024. Then you can see in 3.1.3 is sort of some of what I was talking about around what happens after that is an aligned instructional system. It's actually already beginning, but as Mike pointed out, we're building the plane and flying it at the same time. So we need to have an aligned instructional system now. And then we also need to make sure that it's aligned to whatever updated CCR standard is adopted. Then moving down, you can see in 3.1.4 specifically talks about what the cut scores on assessments would be to meet the updated CCR standard. Part of the discussion that came up at the last meeting was whether there will be multiple measures of college and career readiness to determine college and career readiness. And I had mentioned in the beginning of this session, this piece of the session, that we did have some follow-up and key takeaways from that discussion from the last meeting. So I guess, Dr. Doss, should we keep going through 3.2 or do you want to pivot?
Let's keep going through.
Okay.
And then we'll go back.
Okay.
But thank you for going over that. It's very important that everyone understand when we're talking about an interim CCR, an updated CCR, and how we're going to get there. So you can't repeat that enough. And Mary Pat in the chat actually gave us a little handy, quick definition of what we're talking about right now with the interim standard of college and career ready. So if you folks need to look at that to determine where we are now with CCR. And I want to make sure, because I saw a hand up and I don't know if she still has a question after this. This is Genevieve.
Yes, Dr. Voss, thank you very much. It actually does relate back to 3.1. I know you want to move forward, but it relates to those standards. Do you want me to hold it until we come back?
No, go ahead.
Go ahead.
Mm-hmm.
So I've noted the standards. In fact, during the meeting last month, I left with some incorrect understanding. I now understand that we may have students who are literally taking college courses who may not have met the interim standard on MCAP, but they are in college credit courses without a need for remediation, which is basically the definition of what we're shooting for. But because they do not or did not meet the MCAP standard on English or math or the SAT score, they would be reported as not college ready. So my question is, might there be an opportunity during this interim process and even after the final standards have been completed that we would say, if students are literally enrolled in college courses, college credit bearing courses, that they would be deemed college ready? We would love to report that data for last year, for this year, and for future years, if they are actually enrolled in college courses. And for us, our college courses, the credits transfer for 98% of our courses to the University of Maryland College Park. So I would just hate to send a message that any of our students are not college ready, when in fact, they are taking college courses. So that's a lot. Hopefully it's clear.
It
Do you
is. It
understand the
is clear.
question?
No, it is clear. And they're taking college courses, meaning that the college has already accepted them by whatever means the college accepts them to be college ready. Mhm.
Absolutely.
Okay. Okay. No, thank you for that. And I'm sure that we have that, Rachel.
Yes, I noted that down. Certainly in the interim, students will, in this transition year, students will be able to
I think we lost you, Rachel.
more rigorous courses, including potentially college dual enrollment courses, if they're not college and career ready. And I'd have to double check the law, but there's sort of a point in which it says, you know, at a certain point, we want to make sure that only students that are determined to be college and career ready are accessing the post CCR pathways, so that if they aren't ready, that we make sure they're ready before they take on the additional coursework. But if students are ready, you know, and this is a big, you know, this is going to be one of the big discussions for MSDE and the state board and AIB and everyone interested in this, is sort of like, once we do have whatever our updated CCR standard is going to be, how do we measure that? And how do we measure that fairly for all students? And I think we're going to be spending a lot of time thinking about that and talking about that. It's not going to be something that we can do now, because we need to wait at least to some degree for the study to be completed and to move forward with the whatever those recommendations are about what the standard should be. And part of the study is also how to measure it.
And just to follow up, definitely the study is how to measure it. I just want to reiterate the point that when we have students taking college courses, regardless of what standards have been predetermined or will be determined, we certainly want to make sure that we capture that information. And then I just have a quick follow-up question, Dr. Moss. So if we have students who are in fact accessing college courses because of the requirements or the admission requirements within our state institutions, will we still be expected to provide this access at no cost? They're not CCR by the McCabe standards, the interim standards, but they are CCR by the college standards. And so we've shared with families that this would be of no cost.
Mhm.
So would we have to say, okay, you're ready by the state measure, so we're going to pay for you. But Genevieve, you're not ready by the state measure, so you're going to have to pay for yourself. We just need some clarification, because then it becomes an equity issue.
Mhm.
So
Mhm.
just another clarifying question.
No, you're right on point. You're right on target. But what I'd like to do with that is we're going to come back and we're going to talk about the CCR, and we're going to talk about where we are now and where we hope to be, or where we will be, as far as cost to students, who picks up the tab and so forth. And so that we're getting to some type of standardization with that. Questions came up around that at the first meeting, and so we plan to address it at this meeting. So hold that, you're right on point. What I want to do is to actually, because we did have some questions pertaining to 3.2 and with tutoring and reading and so forth, and I did want to wrap that up. And then I want to remind everyone that for their questions, if you could please place your question in the chat. So that way we're making sure that we get to everyone. I know some of the board members will raise their hand, but for everyone, if you could just do that, that would be very helpful. And I'm going to go back a little bit to Rich. And Rich, if you're still there with us and you remember your question, you were talking about the reading assessments. And could you just, would you mind coming on camera and kind of sharing exactly what your question is? There you are.
Hey, everybody. Good afternoon. Thanks for fielding this question. So my question is, the kids that have entered the school system prior to the passage of Ready to Read, that are in the later grades, that may not necessarily be getting their issues addressed when it comes to their struggles around reading. I say this as a adult dyslexic and the parent of a dyslexic child. Those interventions are not there in the later grades unless the kids are caught in the early stages, and it makes it a lot more expensive and harder to address their needs the older they get. So thank you.
Thank you for that comment. Thank you. That was very important. Then we have a comment from Shane. And Shane, if you could come on camera and address your comment. Shane, are you still with us?
I am. Thank you. My comment was around the scheduling of these interventions that are alluded to in 3.21 and 3.22, along the lines of what Ellie's comment was, how innovative we can be around a schedule that facilitates this college and career readiness focus, both in the instructional part of it, of what may come for the standards, but as well as the interventions. There are some models that have leveraged organizations like were mentioned before, like Latino Student Fund, in times before and after what was the schedule, but are we looking at innovative scheduling that would allow for before, during, and after interventions, knowing that we'll have a lot of students who will need to kind of have additional supports.
Okay, and I'm assuming, Rachel, and I'll let you probably take some of this, that although it's not in the legislation when we're talking about flexible scheduling and so forth in order to get all of these supports in, and I'm going to make an assumption that that would be something that the LEAs and so forth are considering in order to get these interventions in. And the matter of equity comes into play all the time. And that's when you're going to have to talk about some very creative scheduling to get some of these things in that we're talking about.
Exactly. And I mean, the goal is to the extent possible to incorporate them into the school day for those very same reasons of making sure that that they have the opportunities and the supports they need within the school day. But obviously, there are students who are going to need extra interventions beyond the regular school day, and providing those and making sure that students are able to, be transported home. I mean, aligning the schedules, not just with the school day, but with transportation and things like that, so that we're not creating inequities, is going to be really important. And it's one of the, I think, biggest challenges for the school systems is really thinking about what the school day looks like as they're implementing all these different pieces of the blueprint. Because it probably doesn't look the same as it does now, pretty much in many grades, in many schools. And we're hoping what part of what we have been thinking about for technical assistance for the school systems, and we've talked with MSDE a little bit about this, is how to help school systems sort of think differently about how the school day is organized, what the scheduling looks like, so that they could see some examples of different ways to approach it, because it can be hard, sometimes it's easier to create things from scratch than to change what you already have, but obviously we already have what we have. And so hopefully we can find some resources to help the school systems think that through.
Thank you, Rachel. Okay, as I'm looking through the chat, I'm seeing a great deal of conversation, again, pertaining to our updated CCR standard, multiple measures, and the question about students already being enrolled in college courses and along that. So it looks like we may have 3.2 wrapped up, at least for the time being. And let me see, I have one more.
Let me just, if I could just really quickly on 3.2, just wanted to highlight the 9th grade student tracker system that is part of 3.2.2.
Oh, yes, I didn't mean to not go there.
No, that's okay. Yeah, it just hasn't come up yet. But so the reporting requirement begins this year, but the actual tracking started in the past school year. And this is something that requires the school systems to, I look at every 9th grader, incoming 9th grader, to identify if they are, or whether they're on track for high school graduation. And I think it looks at them by the end of the 9th grade. So to look at whether there are already, look as early as possible and whether they are already starting to fall behind in terms of being able to meet the graduation requirements. And potentially there could also be a tie into college and career readiness as part of this tracker moving forward, once we have an updated CCR standard. And then the school boards are actually going to, as part of the tracker system, they're actually, so the data all kind of gets combined up at the school system level and reported up, but then the school systems are supposed to reach out to their high schools and let the schools know which students are on track and which students are not on track, which presumably the high schools probably already know this because I'm guessing the data is flowing upwards, but to make sure that feedback loop is closed. And so we will get the first report this fall from MSDE on the 9th grade tracker, the new 9th grade tracker system. And I think that does cover it. 3.2.2 is really very much related to pandemic learning loss and additional funds and summer programs and tutoring programs that funding was provided for out of the federal ARP funds for to support helping students recover from their learning loss. So that whole section is really tied to the pandemic learning loss. And so that, I think that does cover 3.2.
Okay, good. No, I wanted to make sure we went over that part. So thank you. And 3.2 is so very, very important because we can talk about the CCR standard day and night, but if we're not preparing students, then if we're not helping students, if we're not supporting students, if we're not identifying and targeting where they are maybe missing some things and where they need others, then it's this whole blueprint is not going to mean anything. And I saw in the chat where there was a mention about teacher shortage. And yes, of course, we are all aware of the teacher shortage, and we are all aware of the impact. And we know that some of the things that we're talking about here, as far as the scheduling, as far as that collaborative teacher time, is going to depend on actually making sure that we have a teaching force that can do this, and we will. We will. Okay, I'm going to go on because lots of chatter about the CCR pathways. Rachel, did you want to go ahead and start that?
Rachel, you're on mute.
Oh, you're on mute.
Yes, thank you. So 3.3 is implementing the CCR pathways, and we did touch on this at the last meeting, but we thought it would be worth just sort of going through it. 3.3.1 is the CCR support pathway that I started to refer to earlier. And so this pathway is for students who are not college and career ready by the end of 10th grade. And so what the blueprint calls for is additional supports and sort of a different approach to teaching and learning for students so that they do achieve college and career readiness by the end of high school. And you can see under 3.3.1 are numerous subtasks that identify the particular elements of the support pathway in the law. And so one of the requirements is essentially creating developing an individualized plan for each student who is not CCR by the end of 10th grade, and assigning a teacher to work with each student, really to coordinate that their needs are being met is the idea there. And then 3.3.1c specifically refers to school systems collaborating with the community colleges to develop a pathway or programs that are more experiential and use applied learning so that it's not the same course over again, because we know that doesn't work for most students. If they didn't get it the first time, doing the same thing over again rarely produces a different result. And so this is built somewhat on the what we've called in Maryland transition courses for a number of years, sort of trying to use the community colleges and their they have a real depth of knowledge and experience in providing developmental education to students who come from high school and as adults and are not ready for credit-bearing courses. And so trying to not reinvent the wheel, so to speak, and really try to leverage the expertise that the community colleges have in helping students to become college and career ready so that they can take on the credit-bearing courses that Genevieve was actually talking about earlier. And then there's some more details there, but that pretty much is the idea. And you can see to the right, there are stars beginning in fiscal 24 and then moving for the line out. This, under the legislation that passed this past session, the support pathway, which was originally supposed to begin this upcoming school year, is now required to begin in the 23-24 school year. So next school year. And that is the same timeline for 3.3.2, which are the post CCR pathways. So these are the pathways for students who are college and career ready to focus in 11th and 12th grade on one or more of these pathways, which are essentially college prep. If students who know they want to go on to college or university, that's 3.3.2a. Then there is 3.3.2b, which is essentially dual enrollment or early college, and that is both for credit-bearing courses and credit-bearing courses and credit and non-credit programs that lead to industry certifications. So it's the academic side for dual enrollment, and also the CTE side for dual enrollment in that 3.3.2b subtask. And then there is in 3.4 is also more specifics on the CTE pathway. So CTE kind of touches on two pathways there. But ultimately, you can see in 3.3.2d, the ultimate goal of the updated CCR standard is sort of a compact, shall we say, between K-12 and higher ed, that students that meet the updated CCR standard, and I would submit that includes the measures that are used to determine whether students are have met the CCR standard. What we want to happen is that once students are CCR, every higher education institution, particularly the community colleges, but ideally all of them, will accept those students to take credit-bearing courses at their university or other post-secondary training. And so that is a challenge, but it's something that the state has been really focused on for a decade or more now. And so hopefully we're going to make some more progress on that front. But I know we have been making progress since the 2013 legislation. The acronym sticks in my head: CCR, CCA, so College and Career Readiness and College Completion Act. That was 2013. And so right now, the community colleges and the school systems through PSAM, the Public School Superintendents Association of Maryland, they have MOUs, annual MOUs that they enter into that guide what the community colleges will accept in terms of students being ready for college courses. And so that 3.3.2d, you see the yellow dot in fiscal 25, if I'm counting correctly. And so the idea is that the standard would be updated in fiscal 24. The determination about how to measure the standard would be agreed upon. And so starting in fiscal 25, and we probably should have a line that goes beyond that, that this compact would apply, where students who meet CCR would be able to enroll in credit-bearing courses. And then the last item there under 3.3.3 is accelerated pathways for students who are able to become college and career ready before the 10th grade. And again, you can see the star in fiscal 24 there, indicating that as with the other pathways, that pathway would begin in fiscal 24. And then some other detailed information below there. Oh, the 3.3.3A is for students who defining sort of students who may meet the CCR standard early for gifted and talented students in middle school or ninth grade, and that they would have access to the next most rigorous course that they could enroll in. And that actually, there's a yellow dot in fiscal 22 because, so as a reminder, what the yellow dot means is that there's no actual date specified in the law. So it's an assumption based in part on the Kerwin Commission's timeline for the implementation of pieces of the blueprint, and also the timing of when the overall law took effect. And so that, I think, covers 3.3.
Thank you, Rachel. And CCA, oh boy, 2013, College Career Readiness, and what is it, CCA?
College Completion Act.
Goodness.
Yeah.
So, but I'm glad
Worked on that one too. Yes, another mouthful. Yes.
I'm glad that you brought that up, because that's exactly where we are shifting away from that and making sure that all of our partners and all of the stakeholders are actually shifting with us and understanding the difference between that legislation and what we're moving into now with the blueprint. And I'm also glad that you brought up the community college's role and other public colleges' role, and especially in working with us with the CCR standard, and making sure that once a student is identified as being CCR, college and career ready, that the colleges themselves are actually in a position to be able to accept that student. Also, with this, the pathways that we talk about, the pathways aren't new. Everybody on this call is probably familiar with many of these pathways. It's just that with the blueprint, it expands the access to these pathways. And I keep saying equity and equitable, but that's what's all throughout the blueprint. And it also provides a mechanism for standardizing the process throughout, as far as who pays what and who pays when, and how to get these students in so that they are not paying anything, so that the cost to the students is free. Okay, I'm going to go to the chat, and we have a question from Robin, and it says, Robin, are you on? I'm going to let you come on and read this.
Yeah, my question is, I noticed that there was distinction between students who are close to making CCR versus those who are not close to making CCR. So I guess my question is, how does a school or an LEA, what is the guidelines for that? Because in the past, when students took PARCC in high school, if they did not meet the passing score, it was just you either passed or you failed, and then they went on to bridge projects. So for the remediation of this, what constitutes close? Does that mean that they passed, they had they 3 or 4 in ELA but not math, or vice versa? Or did that mean that their score was actually close versus maybe earning a 1 the first time? Because I know that's going to be a question for schools of what's the difference between that.
That's a great question, and one without an answer right now, but I think I'm glad that you flagged it, because it really in part depends on how what decision is made about how to determine whether a student is CCR or not. Once it is, whether it's, within, 10% of a cut score or 10% of a grade point average or whatever, that does need to be fleshed out more so that it's also applied fairly and consistently across school systems. So that's a really good flag, I think. And I see Dr. Stapleton also saying similarly that the criteria has not yet been identified. It may not just be based on exam scores. It could be course taking, grades earned in specific courses exactly. So it might not just be like a 10%, a plus or minus 10% sort of thing, but something more, even more specific. So we definitely need to put that on our list of our very long to-do list, but that's really important.
Thank you, Rachel. Another question from Genevieve. Will the state advertise to parents and students that beginning next school year, all post-CCR pathways will be available at no cost, or districts be directed to make this fact known to all families? Many of our students will begin planning for next year this fall. Is Mike Hirschenfeld still on from MSDE?
I am.
Can you address some of this as far as any of the plans that MSDE has for marketing or advertising this information?
Yeah, I mean, in terms of the marketing for all of this, this is something that we're in the early stages of, and would definitely be doing that in collaboration with the AIB for anything that the state would want to advertise. Generally speaking, we try to leave as much room as possible for local control and local authority to communicate the things out that school districts are doing. And so this might be one where, there could be some umbrella marketing from the state. But my thinking would be, even though we haven't really gone through it too deeply, is that we would more likely support local districts with materials so that they could effectively communicate to their constituents.
Thank you, Mike.
Thank you.
Have a question from my friend Diana Sung from Frederick County. Diana, can you come on and ask your question?
I can, although my video has been shut off.
Mm.
So I guess you were talking about CCA 2013, right? The one that currently sort of set up all of the dual enrollment programs that kind of exist in the state right now. And there's a lot of very specific things in that legislation about funding, about what percentage the community college is responsible for, what percentage the LEA is responsible for, what percentage the family is responsible for. And of course, local districts and community colleges often have, some agreements locally that go beyond what that minimal legislation funding is. So we have, a system right now where many different districts have different funding models, but there's a basic core, and the at no cost to families takes away sort of the major piece in the CCA 2013 legislation for where the funding for these programs is coming from. And right now, what's not clear to me is, we want to go and update our MOU with our community college this year. And it's not really clear whether we're going to be getting more guidance about state funding for these programs, whether there's going to be some modified expectations of contributions of the LEA and contributions of, the community college, and where will that guidance be coming from, and approximately on what timeline, I guess, is all my questions.
Thanks, Diana. Those are really good questions. And you and I worked together for a long time with CCA. So we're very familiar with that. And I know that Rachel has been in some discussions with MSDE. This also points to the question that Genevieve had a while back, and I said that we would get to it. And also Mike Hirschenfeld is here as well from MSDE, who may be able to chime in on some of this. So I might as well, we'll just kind of go out of order here, Rachel, and you might as well just spring it on us.
Okay, well, so I know that there are lots of questions around this from the school systems, and also the community colleges are asking a lot of questions about this. And so MSDE staff and AIB staff have been talking about providing some guidance very quickly around the upcoming school year, because there are questions about that and how that will work. And then once we do that, we're going to turn to guidance for the next school year, and sort of really fleshing out what does at no cost mean. I saw in the chat box someone asking, does it include books and transportation? Excellent question. And how that would be expected to be implemented, so that school systems can both include all of that information in their blueprint plans that they'll be submitting to MSD and the AIB, but also, as you pointed out, Diana, students are, I think you or someone in the chat box, students are already thinking potentially about this opportunity to dual enroll at no cost, starting in the 23-24 school year. And so it's important to provide that information as soon as we can pull it together. And so not a lot to be able to say right now, but hopefully soon. The one thing I can maybe shed some light on is that the blueprint law essentially replaces the previous MOU process between the LEAs and the community colleges, with more straightforward, but still requiring guidance requirements. And so right now, as I'm sure you know, LEAs have to allow students who are eligible for free and reduced price meals to enroll in dual enrollment enrollment courses up to 4 at no cost to the student. That provision is now expanded to all students. So it doesn't just apply to the free and reduced price meal students. And so that would no longer be part of an MOU. And I know different LEAs and community colleges have reached different agreements around that. The 75% of community college tuition as a charge to from the community colleges back to the school systems is set in the law. There is a provision that says if the LEA and the community college have a previous MOU that provides for a lower tuition payment, and if both parties continue to agree to that, then that would be honored under the blueprint law. So it is possible to continue existing MOUs. I think it has a date of June 2020. I won't try to find it right now, but I think it says MOUs that were in place in 2020. And so a lot of that MOU process between LEAs and community colleges will not be necessary anymore.
That's very important, Rachel, and that's huge too when you talk about the separate MOUs between each of the community colleges and their districts and so forth. And once we get there, it's going to be a lot more uniformity than what we have now across the state. And that would be good for everyone involved. And I want to say, I'm looking at Shanetta. Do you have a question? I see a hand up. I'm sorry.
Yes, I do have a question. Thank you so kindly. In looking at the strategies that are laid out in 3.2 and 3.3, and thinking about or keeping in mind that the blueprint is for all students, I'm very concerned about the students who may be falling through the cracks, many of which may be Black and Brown students, and also those students who may not be on the college track. My concern is that there may not be a specific plan for them. I'm hearing an emphasis on, the college access or the, college courses and things like that. And so I'm very curious about what those other career readiness pathways are and the strategies to support those students who may not meet the CCR standard.
Well, I take the one part of that. For this meeting right here today, we are emphasizing or talking a lot about the college part of the pathways. But in the previous meeting, we had a discussion about CTE, and we talked about CTE being such a large part of this. And I wish that we had the time to even go over that again to make this complete. With CTE, of course, we're talking about apprenticeships and internships and skill-based and experiential learning and working very closely with our local departments of labor and so forth, and workforce boards, and making sure that they are involved in the curriculum that we are developing, and also our CTE committee that is actually forming now. And I think Molly may be on here, and I may ask her to speak to something for just a minute to address Shanetta's question. And there is, we were talking about dual enrollment when we were talking about the pathways. And I do want to put out there that the dual enrollment is not just necessarily for taking college courses per se, or getting the college credit to move on to a four-year university. The dual enrollment is also inclusive of CTE. And that's something that's a little bit different than the way that we thought about CTE before. And many of the community colleges already have begun integrating some of their CTE courses and programs and making sure that they are eligible for dual enrollment, which means that credit, and that means that certification, which is very important. And then we want to also not think of it as something that we're tracking students to CTE because they can't make it in the regular college track. And that whole thinking, that whole platform, the blueprint does away with all of that. And it's more toward an integrated approach. And I do want to make sure, and then of course I'll let Rachel address. Is Molly is still here. Molly, are you?
She is. I just checked, and I'm sorry to put you on the spot, Molly, if you don't mind.
I know.
Oh, no, it's okay. Sorry.
Okay. Yeah.
Well, no, I think just kind of coming back, I'm not as familiar with the CCR standard piece as intimately, but I do believe that a big piece of it is that those that are not deemed CCR ready are provided, with a very individualized plan to support them over their 10th and 11th grade year so that they are CCR ready by the end of 12th grade. And, I think just with that, as Dr. Doss was saying, is that CTE, those opportunities are going to be there and supporting those students. And I don't know if that completely answered the question, but happy to
thank you.
Answer any follow-up.
Thank you. And I'm so glad you're here today.
Of course.
Okay, and then we have another comment that says, something important to note about, this is from Diana Song, something important to note about developing funding guidance is that the fee tuition structure for credit and non-credit or credit and workforce development programs is very different than credit programs. And yes, it is. And it is. And Diana's coming from the community college school district standpoint. And yes, it is. And in a lot of cases, that's actually very helpful. That it is different because in a lot of cases that continuing education workforce development track is a lot less expensive than it is for the credit track. Okay. All right. I don't see any.
I do see one other question from Tim Guy. And if maybe Tim, if you wouldn't mind coming on camera and explaining a little more what the challenges in developing the fiscal 24 budgets.
Hi, Rachel, it's Tim. Sorry, my camera's
fine.
Been used in another meeting. My concern is just as we're looking at building out our budgets for 24-25, and we're looking at the dual enrollment and AP, the definitions for how what fees and costs are being paid for, there's a lot of variability in that, and so it's hard to determine exactly what our ask is. And then for instance, the delay of the timeline for 23, we had put in an ask for 23, and I feel like we came forward with a local ask that was high, and then we shifted it because the pathways didn't open up until the following year. That we delayed the implementation slightly for CCR, or developed a better understanding of what the implementation pathways were. And so we just want to make sure that we're accurate with what we're asking, because we don't want to have to continue to adjust those numbers. And we want to, have an accurate representation of what we're asking for from our local funding authorities.
Thanks, that's helpful. And hopefully, as we work with MSDE to develop some guidance, that will provide some clarity.
Okay. Do we have any other questions? I don't see any other questions in the chat. Just want to make sure that I have that I got to everyone's comments and questions. Oh, we did have a comment from Shanetta, and then a follow-up that talked about tracking off-track status by the end of 9th grade to know if students are meeting graduation requirements feels a bit late. That was earlier. 8th, 9th grade transition may need to be taken into account in beginning the tracking earlier in the 9th grade to understand where those students are followed by appropriate interventions is one suggestion. And thank you.
So I think this is where, and I absolutely agree with Shanetta around CCR. And whether student, we need to start, in kindergarten and pre-kindergarten, making sure that kids are on track and not falling off track. The 9th grade tracker, at least as it is currently envisioned, is very much tied to whether students are on track to meeting the high school graduation requirements. And so you really can't start to track that until they've completed 9th grade. So, but I think that there's an opportunity to potentially, whether it's the 9th grade, whether it's a tracker system or some other, whatever the mechanism is, to make sure that students are, that we know which students are falling behind or off track for college and career readiness at every grade level. And so that's going to be very important, whatever that looks like.
Thank you, Rachel. And we cannot overemphasize how critical time is with all of this. When you start and you look at it and you say, oh yeah, we have a while to get this done. It says 23, 24, and so forth. But just today, many of you have brought to light and have stressed how critical it is that you have some of this information, because you're planning now and you're planning for next year and for the next school year. And then that was one of the questions that Genevieve had about when we say that the funding information will be forthcoming, and can we narrow that timeline down, and can we expect to hear no more by the end of September, October? In other words, just give me some information here to help me with my planning. And so I think Rachel has a little bit more to add to that, that can kind of give a little bit more of a ballpark to that.
Well, in terms of for the upcoming school year, we're very focused on trying to provide something within the next week on that. Hopefully, I think I'm going to go with October as I think that's probably doable. I think if we can get it out sooner, in September, we absolutely will. We do understand that this is a critical issue.
Yeah, we certainly understand.
So I don't know if we want to pivot back to the slides. I think we probably covered some of them in the comments in the chat and questions, but maybe we can see what we've missed. So what we did is we tried to, similar to the earlier in Pillar 4, try to pull out some of the key comments and questions that were surfaced in the last working session, many of which have come back up already in this session. And so I don't know if there's anything you want to focus on here. In terms of the items in 3.3 that are raised here, I think these are really good questions that need to be part of the comprehensive plan and posed to the school systems to inform MSD and AIB and everyone about how they are planning to approach implementing the CCR pathways. But we need to make sure that they're within the guardrails, as we call them, of what the blueprint law requires. And if there are other requirements or guardrails that the AIB wants to make sure that LEAs are thinking about as they write their plans, that we have that opportunity in the comprehensive plan to sort of drill down further than the blueprint law goes in terms of how in 3.3, how the pathways should be implemented with equity in mind. And also to set indicators or milestones, whatever we want to call them, of expectations of implementation progress and qualitative or quantitative data that will be monitored to look at whether progress is being made or that implementation is occurring, as intended. So those are all really good flags for what we need to make sure we're incorporating into the comprehensive plan. Under 3.3. 3.1, I feel, some of this we have covered earlier in the discussion, but this is where, making sure that we don't have bias, implicit or explicit, as part of limiting opportunities for students who can be successful in college courses or post-secondary training. And then this question of multiple measures of readiness and what that might look like.
Mhm. And much of this will be addressed in the report that MSDE has conducted or is conducting through their consultant.
Yes, exactly. I don't believe they've actually selected anyone yet. I think they're still in the process.
Okay.
But Mike, I think you're back. I don't know if you have any update you can provide on the timeline on the CCR study.
Potentially, not that really shifts it too much. I think we're still on track. You are right that the RFP for it closed, I believe, on the 29th or the 22nd of July. And so that is now in the review process. And so obviously I can't share the names of any vendors or anybody. And so even the superintendent has removed himself from that process, and it is with the team that is doing the evaluation. So that's pretty much the most that I can say about it right now. Hopefully that moves quickly. Obviously, in the procurement world, a number of things can come up, and so I think we're on a good path with that.
Great, thank you. And one thing that did come up also at the last meeting was, and there've been some questions, I think, in the chat box earlier as well about the extent to which there will be any engagement with stakeholders during the CCR study, and particularly with higher education. Mike, you don't necessarily have to answer that now, but if you would sort of put that on your list of things to talk to the team about at MSDE, and maybe come back with any response, that would be great. And then in 3.1 also was the aligned instructional system, and sort of this question about balancing local autonomy over curriculum and local control with making sure that students have access to high quality instructional materials that are aligned with the state standards. And so just to make sure that we all are thinking about this the same way, or the terminology. So the state sets standards, and those are required mandatory standards that are that all the LEAs have to meet. And then the state also does provide what is referred to as a voluntary curriculum, which is a sort of a model curriculum that the LEAs can choose to use or not, that are aligned to the state standards. But regardless, the LEAs have to follow the state instructional frameworks and standards. And I believe Mary Pat, I don't know if you're still on though, Mary Pat, I know Dr. Kerwin had asked a question along these lines, and I think that you had done some follow-up on that. If you were still there and want to say anything.
Sure, thanks. I did do a little research, but I got my best answer from Tim Guy, who can probably best answer it. Tim, are you still on? You were explaining to me that I guess it's more of an attestation form that the superintendent sign off when the new curriculum or new suggested standards are developed by MSDE on a rotating basis. And that was one piece of the puzzle. Tim, are you still there?
I am, but I don't think I said that.
Oh, okay.
Sorry.
Maybe it was Shannon Pugh, actually. I'm sorry, but
I
in
think
any case,
in that same conversation, I think we were talking about the difference between curriculum and the standards, and
right.
that we all have to adopt the standards, but we all
Right.
have different ways of getting to the standards, which is the curriculum.
Right.
And then someone else, I don't remember who else, when another blueprint coordinator chimed in and said that it was related to there's attestation forms that come about every few years. They've also been part of our reopening plans, is that we have to demonstrate that we're teaching the Maryland College and Career Readiness standards, and that we're addressing those standards throughout our teaching and learning and curriculum.
Right. And I do remember too, it was Shannon from Anne Arundel County was talking about how in their course curriculums, they always reference that they are following the standards, and then they link to the standards as well for the teachers to at least have in their packets and so forth. I think that's the best answer I can give you right now.
No, I think that's really helpful. So essentially, every LEA has to follow the state standards.
Correct.
And they have to incorporate the standards into the curriculum. And it's up to them how they do that. And they have to attest that they have done that.
Correct.
Okay. Thank you. And then the last little bit here on 3.4, which Dr. Doss did a great job of summarizing the discussion earlier around career counseling, which and CTE expansion. And I just want to emphasize that career counseling was a major topic in the Kerwin Commission, and the need to start specifically providing career counseling to students by middle school so that they start thinking about what pathway they might want to pursue, whether it is towards college or towards a CTE field or a post-secondary training or a certificate program. And so the importance of that counseling being available beginning in middle school to every student, and also that there are not that guidance counselors are overwhelmed with their responsibilities. And one piece that often, because they're dealing with more urgent issues, doesn't always happen is the career counseling side of it. And so actually creating adding funds. So funds were added to the blueprint funding to provide additional funding to specifically provide career counseling to students, whether it is via career counselors in the schools or utilizing their local workforce development board and providing the services in other ways. And so that hopefully that is part of, I think it was Shanetta who was asking about making sure that students that the career pathway is clearly available to students and that they are aware of their options. And so under number 1 there is making sure that we as we implement the blueprint, we monitor the ratio of guidance and career counselors to students by LEA and by school, to make sure that students are getting equitable access to those counseling services. And then a couple of other points related to the CTE committee and CTE programs is developing a strong collaborative working relationship between MSDE and CTE committee, particularly around administering Perkins federal funding, because MSDE will continue to actually receive the funds and allocate them. But as was discussed at the last meeting, the CTE committee needs to have a strong role in advising MSDE on how they would recommend allocating those funds to various programs. And then number 3 is really focusing on redesigning CTE programs, both existing programs and new programs, to incorporate apprenticeships. And in the new model of apprenticeships that Maryland is pursuing now, which is a little different than when the blueprint was first passed. All of the apprenticeships would be registered apprenticeships through the process that currently applies for apprenticeships through the Maryland Department of Labor, the Apprenticeship Council. There's another word that I'm missing there. They have to, Apprenticeship and Training Council, I think, has to approve all apprenticeships. And then also the CTE committee would need to be approving the high school level of apprenticeships that would be aligned or articulated using some higher education language, articulated from the high school level into the full registered apprenticeship, so that students who participate in a registered apprenticeship in high school are on the pathway to complete that apprenticeship and receive that credential after they leave high school. And so that is and then also incorporating the educational or instructional aspects of the CTE into the apprenticeship, so that it's sort of its own self-contained program of study, essentially.
And I did want to make a point. Thank you, Rachel.
Yep.
I did want to make a point about the career counseling, guidance counselors. Counselors often end up being the gatekeepers to resources and opportunities. And it's, again, and I keep saying this is important, and it's also important that they understand the pathways and how students are to get to these pathways, how they become eligible for the pathways and what's in the pathways and so on and so forth. So I'm wondering, and this may be a question from Mike or just a comment from Mike, is there a way that we can determine what we are doing, and I guess I'm saying MSTE in school systems, to actually guide the guidance counselors on the blueprint, to train the guidance counselors on the blueprint, the professional school counselors that are in the school system?
Again, I'm sorry, I'm not going to have a great answer. But what I can say is that what Blueprint does require, and I would make the strong assumption that we would build this out even more fully than what is required, requires a system of professional development, not just around the career ladder as is explicit, but also around the new system, the new courses and resources and materials that are generated as a result of the revision to the CCR standard. And so without having anything written in stone or knowing 100% about exactly the direction that it's going to go, I would strongly assume that guidance counselors and other appropriate staff would be included in that process on our end in terms of creating professional development and support for those functions.
Mm-hmm. Okay, and if we could also make a note, and I see some things in the chat as well about career counselors and guidance and implicit bias and so forth, that comes along with it, just about anything that we do. And to make a note that that is part of the professional development that we do with our professional school counselors. Okay. Do we have anything else in the chat? My, how time flies when you're having fun. Oh, we do. We just have a note from Denny that says we need to include a robust amount of resources for dreamers and undocumented students. Thank you, Denny. Thank you. Thank you. Okay.
Great. So I think that time's out perfectly.
Right. We're at the end of today's session, but we will come back to this pillar.
Yes, we will. We will have at least one more, probably more than one, more session on Pillar 3 this summer.
Yes, please. Yes, please. And again, I want to thank everybody for your participation and your questions and your comments. They're so welcome, more welcome than you probably know.
Well, Mara, let me thank you for so graciously moderating the session. We all appreciate it. And Rachel, I guess our next meeting will be next Thursday.
Next Thursday at 1 p.m. and we will be talking about early childhood education
Okay,
with Dr. Jennifer Lynch.
great. Well, thank you all. Thank everybody who participated, and thank you for your tremendous and very, very, very important and useful input. So we'll see you next week.